Hey, good morning, good afternoon, good evening, wherever you may be in the world. Thank you for joining this video. It's going to be a good one. I'm joined here by Lynn. Hi, Lynn.
Hello.
Usual one word. Today, this video is going to focus on my first book that I wrote. And I'm going to talk a little bit about why we did it in the first place. So I was the first UK appointed dementia specialist, the dementia doctor specialising solely in dementia. This was around about 2002, 2003. So over the years, I've gained a great deal of experience working in a clinical setting, an educational setting, and a research setting in the field of dementia. So over the years, Jessica Kingsley Publishers have approached me a number of times to write a book. And I never really had enough material until the years passed, until there was sufficient information, sufficient material, sufficient experience, and things that I could fill a book with. So in 2018, Jessica Kingsley Publishers commissioned me to write my first book. And the book is, despite the title, is for everybody, and it is useful for everybody. And I wrote it with that in mind. The publisher wanted the title that it has. I didn't choose the title, they did. It's a commissioned book, so pretty much, the publisher is in charge of everything that you do and everything you think about. So the book is called A Clinician's Guide to Non-Pharmacological Dementia Therapies. Hopefully you can see that. Okay, that good, Lynn?
Mm-hmm.
Okay. It consists, so it was commissioned in 2018, and at this time I was living and working in upstate New York. I had quite a lot of time to write this book. So it was commissioned in 2018 and it was published in 2019. I think it took me about 6 months altogether, because once I started, I couldn't stop. It just flowed. Everything flowed. All my knowledge, all my experience, it just flowed. So it was pretty quick from start to finish. It wasn't too challenging to write. And it consists of 12 chapters, and each chapter is very, very practical, with case studies, with models of approaches and interventions and interactions and engagements. And as I said, it's good for everybody. People living with a cognitive challenge, their caregivers, professionals supporting their journey. And it covers many, many things and many areas, ranging from older people who are living with cognitive decline, cognitive challenge, cognitive change, Alzheimer's disease, vascular dementia, Lewy body dementia, rare forms of dementia that we don't hear a great deal about. How do we work with those people? How do we engage and interact with people who are living with severe forms of dementia? What interventions do we use? What models do we use? And it's a whole range. So there's 12 chapters in there. And it also talks about children, because, there's 1 in 150,000 children are born with a form of neurocognitive disorder. And those guys tend to present with the symptoms and the challenges when they get around about the age of 10 or 11 or 12. And unfortunately, currently, there is no cure for childhood dementia. And the approaches and the interactions and the interventions and the engagements are very, very similar to adults who have a neurocognitive disorder. However, we have to do things differently, of course, because they're children. So obviously our approaches and interventions, while similar to what we use with older people, have to be modified and changed. So there's information about that, and there's approaches, and how do we work with those guys, and how do we improve quality of life. So everything in A Clinician's Guide is really about improving quality of life. It's not about cures. There is no cure. Today, to this moment, as I speak to you right now, in 2024, we do not have a cure for primary dementias such as Alzheimer's disease. There are many promising treatments and therapies that are geared towards slowing down the progression of the disease, clearing away the beta amyloid, the plaque, the tangles, and making a difference there. But everything is geared at the moment towards slowing down the progression of the disease. A lot of the work I do, of course, is all about living with and living well with, and brain health therapy and psychotherapy and cognitive behavior therapy and hypnotherapy, and all those things are talked about and described in here. Now, of course, a number of years ago, myself and a colleague in the UK, Dr. Simon Duff, we did some research, some groundbreaking research, as it turned out to be, using hypnotherapy to improve quality of life for people living with a neurocognitive disorder. And our evidence demonstrated that hypnotherapy was a really good tool to use. It's a good therapy. And over the years in clinical practice, I've been able to adapt it, I've been able to evolve it, and I've been able to use it to good effect with many, many patients. I've used it maybe 3 or 4 times this week, actually, with patients. So hypnotherapy there's a full chapter dedicated to the research, how it was done, where it was published in Europe and in the US. And it's also backed up by a longitudinal study that we did. So it's hypnotherapy is talked about extensively in here. And I have a number of dementia consultants around the world that have trained under me and have learned how to use many of my approaches and interventions and techniques. So, and a lot of it is in here. One of the very exciting things in here is about animal therapy. And as people who watch my videos and follow me on Instagram and Facebook, you know that animals are a massive part of my life, a massive part of my world. And I've been involved with animals all my life, and using animals in therapy with people who are living with dementia has also been something I've done for many, many years, extensively. Ranch therapy, horse therapy, pet therapy, working with dogs, and the connection between animals and people who are experiencing communication difficulties is an amazing thing. Animals are an amazing tool, an amazing vehicle for communication. We, as a doctor working with patients, I put pressure on people. We set goals, we have expectations, we are looking to improve quality of life, but the person has to work at it. The person has to put an effort in and really, focus and adhere to. When you're working or engaging with animals, there's no pressure. You don't have to verbally communicate with a dog or a horse or any other animal that doesn't use our human language. It's more about body language, it's more about emotion, it's more about touch. And that is why people who have, for example, PTSD have such successful stories with wild horses, in particular Mustangs. There appears to be this connection, this real connection between a wild Mustang and somebody who is experiencing PTSD, especially veterans of war, veterans of the police force and things like that. There's this huge connection, and it has a positive outcome. And I think maybe chapter 12, I'm not sure of all the chapters, but it could be chapter 12 that talks about ranch therapy and talks about the impact there. In this book, there are so many case studies and examples of what works and what does not work. So it's always about positivity. It's always about positive outcomes. So whether you're reading and learning, this is a good learning tool, good educational tool. And I would suggest that everybody who is studying a program in dementia, whether it's a certificate in dementia, a diploma or a degree or a master's degree or a doctorate, This book will prove invaluable to students. So recommend it. It's available through Amazon. You can get it through good bookstores. You know, it's out there. And my feedback is that it's a very valuable resource. So make sure you've got it in your library. Read it, learn about it. Any questions, ask me, that's fine. So that's what I wanted this video to be about, you know, about this resource, about this tool. I know there's many people around the world that have got it, that have invested in that and found it very useful as part of their library. If you haven't done so already, go ahead and do that. And as I said, if you have any questions about any part of this book, then please contact me. I just also want to support this video by saying, please share every video that is posted on my YouTube channel. The whole point of the videos is for education. Education, education, education. We are seeing a continued increase in young onset dementia. And the main reason for this is because of diet, lifestyle. Those two things are very important, diet and lifestyle. Two reasons why we are seeing an increase. Diabetes, there's an increase in that, which linked to Alzheimer's disease. There's an increase in obesity, linked to heart disease, cancer, stroke, dementia. You know, we can do so much to reduce all that risk just by addressing our diet and lifestyle. But this is all about education. So please share every video that we post on my YouTube channel. Every post we place on Instagram, share, share, share. The more followers I have and the more subscribers to the YouTube channel, the better it is for the whole nation, the whole world, because that's what it's about. It's about education. So follow me on Facebook, follow me on Instagram, find me on my website, drdanielnightingale.com. You can find me through Psychology Today. If you have any questions, if you need any help, need any guidance, please contact us. I always answer questions, and I always respond to requests for help and assistance. So that's where I'm going to leave it today. Please remember, and please say it with me and Lynn. Are you ready, Lynn?
Sure.
1, 2, 3. Dump the soda. Thanks, guys. Take care. Catch you soon.